Now joining me this time from Washington, D.C. is healthcare policy expert David Hogberg. David is here to comment on the VA scandal as all that is related and all that is related to it. David, welcome to the show.
Thanks for having me.
So, tens of millions of dollars going to employees that are considered to be overpriced and mislabeled in terms of their job description. Give us the details on this, please.
Well, I think the basic thing to take away from it is it's simply that bureaucrats will take care of bureaucrats. That they are as self-interested as anyone else, and this is kind of the result of a system in which, like most bureaucracies, the customers, in this case, of course, in the case of the VA, it's the veterans who are patients, do not actually control the funding. In normal markets, of course, customers do control the funding, and if employees of the company are overpaid, or if the company, say, makes customers wait too long, the customers will eventually take their dollars to businesses that don't make them wait, that don't charge them higher prices because they overpay their employees and so forth. And that business will see a loss in its revenue and will have to either shape up or go under. There's no such pressure on the VA. Its funding comes from the taxpayers year in and year out, and as a result there's no consequence for poor customer service, and so you see employees overpaid, and you get things like the wait time scandal where veterans suffer, their health suffers.
Yeah, and in fact, as you know, David, a lot of veteran advocates are calling for those that are on wait lists right now, those that are waiting for treatment, to have the option to see a private practitioner, to have an opportunity to see a private doctor. So this is essentially, David, I'm assuming this is essentially what we're looking forward to as a society in Obamacare.
Well, the VA is a little ways down the road from Obamacare. I mean, I understand the VA's healthcare system is basically socialized medicine. I mean, the government pays and owns the hospitals and runs them. With Obamacare, we're not there yet, but if Obamacare were to lead to a single-payer system, to something along the lines of socialized medicine that you see in to a great degree in Great Britain, to a lesser degree in Canada, yes, this is what our future would look like. Sure.
All right, coming back to the VA for a moment here, let's bust some false narratives. There's a narrative out there which says that the problems of the VA scandal have been caused by a large amount of veterans moving from snow belt states to sun belt states, putting pressure on those VA systems. True or false?
Oh, that's false. That's been put forward by a journalist by the name of Philip Longman, who actually wrote the book called Best Care Anywhere, Why the VA's health care is better than yours, and as you can imagine, he's been scrambling a bit in the last few weeks. He put forward this argument, but the fact of the matter is the data does not support it. I looked, for example, at the VA's recent audit on the wait time scandal. Of the 81 problem sites, problem facilities, 41 were in Sunbelt states, 40 were not. My intern and I also looked through other government reports, like from the Government Accountability Office and so forth, that dealt with VA wait times. Of the ones that mentioned specific facilities, 21 of those facilities were in Sunbelt states, 22 were not. So this is really a system-wide problem, and it's largely caused by the incentives and constraints that a bureaucracy like the VA faces.
And again, this gentleman, this author, as you say, he's drawing the analogy, not the analogy, the connection between Obamacare and the VA, putting the VA out as an example of why a system like Obamacare should be so delightful. You talked about incentives. One of those incentives is to manipulate wait lists. We've heard a lot about these wait lists. Tell us about the manipulation that goes into the wait list.
Oh, sure. Basically, the VA has a standard, a 14-day wait time standard. That is that patients are supposed to be able to see a physician within 14 days. And things like promotions, bonuses can be dependent on how well a facility meets those that standard. Well, facilities that weren't meeting the standard would manipulate the wait times, the data in various ways. And as a result, we ended up with 50,000 veterans on a wait time, and another 60,000 are on a wait list, and another 60,000 that didn't end up on any wait list at all. So you don't end up on a wait list. There's no, you can't start counting for the 14-day wait period. One of the reasons for this, that this happened, is because the VA, like employees at the VA, like most employees at bureaucracies, have protection under, are protected under civil service reform, which makes it very difficult to fire them. And if you can't fire someone for cheating, for manipulating the data, well, when the data is getting your bonuses dependent on the data, then yeah, you're going to see more cheating.
Bottom line is the VA crisis continues to show deep legs to it, deep roots to it, I should say. It's far from over. The problems are systematic. And as you say, David Hogberg, as long as bureaucrats run a bureaucracy, this is what we can expect. All right, David Hogberg, healthcare policy analyst from the National Center for Public Policy Research. Thanks for joining us.